Hi, and welcome to the VCU RRTC on the Employment of Persons with Intellectual and Developmental Disabilities webinar series. My name is Josh Taylor.
And I'm Lauren Avellone.
And we're going to talk to you today about some of our research around the employment service settings that individuals with intellectual and developmental disabilities receive services, and how we can move folks with intellectual and developmental disabilities from the segregated settings where they often receive services towards competitive integrated employment, which is really the focus and ideal outcome set forth by some of the legislation we'll talk about here in our webinar. And so before we get too started, we want to give a little bit of background about sort of the historical context on the employment of persons with IDD, and sort of how we got to where we are today, and sort of the problems that are faced that we've tried to examine in our research. So to give a bit of background, so back in the kind of mid 20th century, as individuals with intellectual and developmental disabilities were transitioned out of or deinstitutionalized from those very restrictive state institutional and state facility settings, you know, it wasn't just a matter of, you know, individuals with disabilities were moved straight from institutions to integrated community settings and into workplaces alongside individuals with without disabilities. Often they were moved towards segregated settings that were a little maybe less restrictive than those state facilities, but were still isolated from the community and really a very structured supervised setting only with other people with disabilities. And often these were doing kind of quite menial tasks that weren't individualized to the people working in them. And many businesses received waivers to pay individuals less than minimum wage, called a 14C waiver. So these shelter workshops and adult day rehabilitation centers still persist today as an outcome for many of the folks with intellectual and developmental disabilities. And what we've seen is that, you know, increasingly, and especially with the recent passage of the Workforce Innovation and Opportunity Act, or WIOA, in 2014, we really have an emphasis on achieving competitive integrated employment as the preferred outcome for all individuals with disabilities, including those with IDD. But what we know is that despite decades of research showing that we have models for how to achieve that, for even folks with the most significant disabilities through approaches like supported employment, customized employment, still a majority of youth and adults with IDD are receiving their services in these segregated settings where they're not given an opportunity to get what we know works to achieve CIE, or that competitive integrated employment that is really what we're aiming for with the practice and policy that we put forth. And so if we look a little bit more in depth about the statistics, so this is from the National Core Indicators data, looking specifically at outcomes for young adults with autism. So those that are kind of have just left high school and are looking to integrate into the workplace. And again, remember the ideal outcome is that competitive integrated employment. And we can see in that column on the left, only 14% of the individuals with autism in this sample are achieving what this legislation and policy has really set out as the preferred outcome for that. And if we look one column to the right in the center there, 42% of those are engaged in unpaid vocational activities in segregated facilities. So a bulk of the group here is not engaged in CIE, but rather is in these day programs, shelter workshops. And then kind of even more frightening, 27% of those in the sample are not engaged in work or any kind of activity at all, or are sort of totally isolated from the world of work, so to speak. And we can see if we look at the data over time, now this shifts a little bit to not just individuals with autism, but individuals with intellectual and developmental disabilities. We can see a clear trend. If we look at the bottom, that's that competitive integrated employment. So we can see a little bit of a rise over the course of the 90s and kind of growth there. But since the 90s, pretty much a straight plateau with very little growth and improvement towards getting more individuals with IDD integrated into employment settings. So we can also see in 1999 is when the Olmstead decision was passed. And so that really put restrictions on really emphasized that services needed to be provided in integrated settings, not just vocationally, but also in housing and lots of different areas of services for folks with disabilities. But we can see a real sharp decline initially in the engagement of facility-based work, but what we see is a massive growth in sort of those not engaged in work or vocation at all. And so that's very frightening, and something that we definitely need to address. And so we don't want to get too into the policy for this, but just to give an overview of sort of some of the main policies and pieces of legislation that inform the employment services for people with intellectual and developmental disabilities. The three big ones are the Americans with Disabilities Act, or the ADA, the Olmstead decision that we talked about a little bit, which informs the ADA, and then the recent passage of the Workforce Innovation and Opportunity Act. And so these each provide different contexts or different sort of regulations on that affect the employment of people with disabilities. But essentially, the ADA grants that people with disabilities have a right to access to services within their communities, and so that provides kind of a broad provision of universal access for this group that is really oriented to reduce those barriers to engaging and being included in those activities, whether those are vocational or employment, or going to a restaurant, or going to school, or any part of community life. So it's very, very broad. So the Olmstead decision was a decision in 1999 that informed and placed a precedent on the enforcement of the ADA, that said that people with disabilities had a right to receive the services that supported them in an integrated setting. So it wasn't enough to provide those in a segregated setting, but really they had the right to receive those services in a community-based setting. And so this also has a lot of implications for work and employment, because it really said that those services need to be provided in a workplace, a real workplace, not a contrived space that's segregated from the community as a whole. And then more recently, the Workforce Innovation and Opportunity Act really established competitive integrated employment as that desired outcome. So really, all of the vocational services that are provided for folks with disabilities, what we want to be aiming for is that competitive integrated employment. So what was deemed kind of work closures and other options weren't really a preferred outcome anymore. And it also moved to phase out some of that sub-minimum wage waiver system, and also to make sure that young adults that were just graduating, entering adulthood and entering the workforce, that they weren't entering shelter workshops. So it didn't necessarily ban them altogether, but certainly moved to making sure that young adults moved into more integrated settings. And so a little bit of background about the research leading up to now, over the last several decades, that informs some of what we know about providing vocational services in different settings. First and most importantly, I think, is that we have several decades now of research that shows that we have ways and we have evidence-based approaches to ensure that individuals with even the most significant disabilities can achieve competitive integrated employment, can be beneficial employees in workplaces in a variety of industries. So we know the how, and that's really important, I think, to understand foundationally before we get into some of the minutiae of this, is that we have approaches that work for helping folks with intellectual and developmental disabilities to be successful in those workplaces. But on the other hand, we also know that the outcomes that we're seeing, as we saw in those graphs and those charts, they're not matching up with what legislation has put forth as what needs to happen. And it's not meeting the expectations of what those programs and policies were set forth to do. So we still have some considerable ground to make to really meet the legislative intent of those laws and policies. And as we saw, this is a study by Rush and Braddock in 2004, but it's still true. We can see from the data we look at today is that those segregated services are still more likely outcomes for this population of folks than CIE is. And so in spite of all this research and all this policy, we're still seeing more folks going into these segregated settings each year than going into CIE. So this is certainly still a problem that needs some attention in research policy and practice. And really, one of the key problems that's been talked about over and over in the literature is that in order to really move the needle in this area, what we need is a more seamless transition. And what we mean by that is we need a coordination between schools and school staff and school systems as they come out, as students come out of that transition process, to seamlessly work with adult service agencies to make sure that as students and transition age youth are moving from those school systems into adult service programs, that there's a seamless transition where they're moving into more competitive settings rather than either falling between the cracks and moving into that non-work category or moving into the segregated settings. And so this is a real area where there have been calls for it for several decades, and we still need more attention, more policy. And so this kind of leads us to the purpose of our current review that Lauren and I have been working on, which is really looking at, okay, so if we know that individuals are still ending up in these segregated settings, in spite of all this policy and practice that says that, one, we can achieve, positive CIE outcomes for this group, that we know how to do it, and that there's a possibility of making that happen. Are we missing some evidence that that's out there in the literature that may support segregated vocational services that maybe could explain why individuals are still going into that? Or on the other hand, is there evidence out there that really contraindicates or says this is actually a negative, has a negative effect on the outcomes that folks experience after these segregated services? And then the second part was really to look at a comparison between those two. So, so what do we know can support or dissuade us from using the segregated settings? And then how does that compare to when we provide vocational services in integrated settings? And so I'll turn it over to Lauren. I want to talk about a little bit about how we sort of went about analyzing some of the literature we found.
Yeah, so Josh mentioned that we were really looking at how competitive integrated employment outcomes could be achieved. So that includes employment positions within the community that has comparable wages and is also among other individuals without disabilities. And to do that, we were looking at different types of service delivery models, those that are either already integrated, which we refer to as integrated, or those that are more in those segregated workshop settings. And so we wanted to do kind of a broad investigation of the literature, and by following those guiding principles that Josh just mentioned on the previous slide. And so we looked at a wide range of types of literature, which I'll go into in just a minute on the next slide. But after looking at those types of literature, we wanted to organize them based on the following format. So we really looked at the citation. So, what year was the study conducted? Also the population. So we looked at diagnosis, age, and different other demographic variables that might have any weight on some of our findings. We also looked at the type of research design. This is a huge theme that Josh and I have gone back and forth with a lot. There's different levels of methodological rigor, and that really looks at strength of findings. So on the top tier, you have more randomized control designs, and that sort of scales down into more quasi-experimental and some correlational designs and even some case studies. And so the different levels of rigor can really offer more or less strengths of support for findings. So we wanted to document that in all of the studies that we were including. And then with the type of vocational service models, that really gets at what I was just mentioning with that integrated versus segregated component. So we definitely documented that in all of the pieces that we were including. And then the intervention components get into branching apart those segregated and integrated. So for example, some of the integrated models, we have supported employment that we discuss a lot, but also customized employment is an integrated service model. So we branched out what was actually included in these different studies to promote the outcomes. And then of course the outcomes, we were looking at a kind of a wide range of positive employment indicators like how many hours an individual would be working, what their pay was, what industry were they in, um, did they receive benefits? So, sort of capturing a wide picture of what all of the different outcomes were. And then the findings is just a summary of all of those that we included.
It's a great point, Lauren. I love it you brought up about the kind of levels of research design rigor. That's so important, I think, when we think about what the takeaways of a review of the literature are like this from a variety of perspectives. I have a friend that describes research as sort of baking bread. And so, baking bread, allows you to put exactly the ingredients you want to get the outcome that you want, but it doesn't necessarily satiate you if you just want a sandwich. So I think when we can look at things like what's the level of evidence that supports various things, I think it lets us look at, what do we know that's going to inform how we do what we do in practice, but then also like where do we need an additional level of research rigor to continue to add that case for one type of service over another, or one type of intervention or setting over another, or one type of group over another
Yeah,
sometimes.
absolutely.
Yeah. All right, so I'm going to talk a little bit about sort of all that we went through to find those needles in the haystack.
Yes, as I mentioned, we looked at a review of the literature. So, in particular, we used a scoping review methodology. That's a lot broader version of a systematic review. So, you start with kind of a general research question, and then that allows for more generalized findings. And we included quite a few different pieces in order to review. So, we looked at peer reviewed literature. So, that's captured within the empirical databases, and then also gray literature sources, which can be more like white papers, government documents, just general reports. And then we also looked at reference lists. So any of the sources we accumulated from those two often have pieces that they built their information off of. So we scanned through those to make sure that we included all of those as well. And then once we get a collection of those articles, we have different levels of review. So the first is a title abstract review. And so we screen based on whether or not set criteria that was agreed upon before conducting the search, whether or not those pieces actually meet that criteria. And then we scale down even further to a full text review. And then finally, when we have a complete collection, we do an inter observer agreement. So we have multiple reviewers make sure that we all agree that these final pieces do in fact meet all the parameters of what was intended for this review. And so as you can see on the right, we have a flow chart of that process I just described. The initial search in the databases returned quite a few articles, so 589. And as we scaled down to the bottom, we went through that full text review that I mentioned and finally ended up with a collection of 5 total articles, with one of them being from that reference list scanning process that I mentioned.
All right, shall we tell them what we found from the research?
Of course.
So I think most importantly overall, and kind of in line with the real core purpose, was really to look at, is there anything out there in the research in the last several decades that provides any support? If we're still seeing these outcomes, and we're still seeing individuals with IDD placed continually in these segregated settings, is there anything that can support that maybe it is more viable than we thought before? And conclusively and across the board, we found no support within the research evidence for those segregated services. They didn't lead to better outcomes in any indicator that was included in the review. So that's, I think, the most important takeaway from this review is that finding in and of itself. So then when we shifted to the second purpose and the second part of that, where we really compared kind of what we found from the systematic review of that segregated literature or lack thereof, and compared that with what we know works from these integrated service delivery models like supported employment, like customized employment. We found several sort of findings that I think will help to make for a cleaner comparison between the two. And for one, those integrated services, you know, as we said before, this came up again and again in literature, is that these approaches work to increase the engagement of individuals with IDD in competitive integrated employment. So the segregated models, you know, didn't achieve that, and in a few studies even led to less likelihood down the road that individuals would be able to benefit from services. So actually had a negative effect on the likelihood that individuals would later engage in CIE, but also we know that these integrated services do work. They also led to increased wages. And so when individuals were engaged in models like supported and customized employment that were integrated within integrated workspaces, they led to better wages down the road.
One of the key points too, just to add on there, is that when we look at the differences between integrated and segregated service delivery models, really what segregated models at the heart of them are sort of a pre-training model. So they're spending time training individuals with disabilities, employment skills in settings that are not integrated, and versus the integrated models, which really immerse an individual right out of the gates and then train them in that setting to have that skill set. And so one of the really key findings in what Josh is saying is that that need to have time in a pre-service model, or to spend time training before you can move into an actual community employment setting, isn't really justified or indicated by the research that we found in this review.
Yeah, that's a great point of clarification, Lauren. And I think, you know, really, to me, it makes sense when we think about not just the literature and what we know from research about sort of the employment for adults with IDD, but even if we look back to some of the predictors from transition age youth, one of the things that pops up, not only one is that if folks have paid work experience, they're more likely to then move into competitive integrated employment, but that expectations piece, right? That's what jumps out to me, is that, you know, the higher the expectations of an individual and their parents and their sort of core team are about the outcomes that they're going to achieve, they're going to be more likely to achieve it. So to me, what that speaks to is that those expectations we have to really challenge and provide opportunities for those individuals to succeed really outweigh any of the benefits of that training piece, especially when it's in a segregated sort of contrived setting. But I appreciate you bringing that up. So the next piece, you know, we did find there was a little bit of evidence on sort of the health outcomes, but really that was inconclusive. There was some indication of a positive correlation. So a few of the studies had included that looked at integrated service delivery models, included some health indicators. Usually these were related to quality of life, personal independence, sort of other aspects of physical or mental health. But since those were sort of secondary measures a lot of the time, this was really inconclusive, but we do have some indication maybe that there's a positive relationship between integrated work and health that may be able to be investigated further in future research. So some promise yet to come. We did find that those integrated services did lead to increased quality of life in a few studies that examine those. Again, the level of evidence was a little bit weaker than we found for some of the economic outcomes like wages and like the sort of stability of job employment itself, but did find some increased likelihood of quality of life. And then the last piece is self-determination, which really is a very critical piece. Self-determination really gets at how an individual has agency and control and advocacy over their life and the outcomes, the things that are part of their life. And this is obviously a great thing in and of itself, and we want this for all individuals. But this additionally is really important because we have some indication from the research literature that individuals with higher levels of self-determination themselves have better employment outcomes. So this is an area where it's kind of there's a process where each of these things may build on each other. So self-determination and employment may mediate each other in interesting ways, that the more that individuals are in kind of real life workplaces and are given responsibility, they have more opportunities to practice and increase those self-determination skills and develop more agency, which then in turn makes them more successful in those employment outcomes. And so you can really see that that providing these experiences and opportunities and providing these integrated services and supports can really put folks on a very positive trajectory that wouldn't otherwise happen without these services. And so, Lauren, let's talk a little bit about kind of where we go from here. So, again, we found that really no research to support the segregated services. We found some really promising support for those integrated vocational models. So I think that, the first one for me is really, even though we found some very positive associations between integrated settings, I think we need more rigorous methodology, right?
Yeah, I think that there are, as you mentioned, a lot of different variables too that can be measured. So self-determination, quality of life, in addition to just employment outcomes. And those are aspects of employment that are kind of quality
Mm-hmm.
indicators. And so in addition to just including more rigorous types of methodology, maybe sort of examining different levels of dependent variables that could really inform some of the quality of employment and how that affects different individuals with intellectual and developmental disabilities.
That's right. I mean, you and I have talked about it a bunch of times that this idea that, by measuring some of those other outcomes, and getting a better understanding of those, we can really see that the investment in employment is really not just about employment. It's really about health. It's about independence. It's about all these different parts where we're getting sort of more bang for our buck, so to speak, or more cost efficiency than just the employment stuff, right?
Mm-hmm.
And then, I think it's also important, that second bullet point too, thinking about all of the different services that individuals with disabilities get as part of sort of vocational rehabilitation, with VR services and those provided under other funding and service programs. But, that can look very, very different from individual to individual and context to context. And so really just more research that looks more specifically at what are the services that folks are actually getting, the intensity and duration of those services, how much job coaching are they getting, how much follow along support, right?
Mm-hmm.
And then also thinking about, we talked a little bit about, these calls for a while back about more focus on that seamless transition. But, really looking at investigating how these teams work together. A core part of WIOA was really re-emphasizing in legislation this interagency collaboration, but investigating how they actually work together, is certainly an area that I think we would love to know more about. And then I would say the last one is just really looking at like addressing some of these barriers. There's some really good research from some of the community conversations that Dr. Eric Carter and other researchers have done in the field, that have Alberto Migliori as well, on so some of the concerns and barriers that families point to. And I think that's something that we shouldn't overlook, right? That we know what works, but also, there are reasons that families and individuals are choosing to continue to go into these segregated services related to their perceptions maybe of the safety of workplaces, or the potential or benefits, even the need for kind of federal subsidies and benefits that may be part of family income, and how that can affect sort of expectations around work too.
And there's other variables too, when you consider competitive integrated employment. Just on the perimeter of that is really like transportation concerns or things like that, funding to get there. So really assisting families, how can we do that in a way that helps them conveniently get to jobs if they need transportation, or remove that as a barrier, since it does seem to come up quite often as a consistent theme as being a concern for families in order to kind of not achieve competitive integrated employment, but actually maintain it over a duration of time.
Yeah, that's a great point. Okay, so shifting along to implications for practice, and I think the first one we talked about in a little bit earlier has been called for a while and is still, I think, really a point of emphasis is that transition piece. And so making sure that prior to graduation, that individuals are getting work experiences as part of their transition programming prior to graduating, and really have those expectations that give them opportunities to kind of practice applying those skills in real life settings, raise expectations, you name it. There's just a tremendous amount of benefit. And then the other is that the kind of coordination between those two service agencies, right? And then the other piece I think is getting that information out to family members. And so, you know, kind of as we mentioned a little bit about sort of those perceptions of barriers that can really influence expectations and influence the choices that are made by individuals and their families. Really getting much more information about everything from, you know, what does the research show about the possibilities of some of these services and these approaches and programs, all the way to kind of benefits counseling and informing individuals and their families about, you know, that even though that benefits may be adjusted based on income for individuals, almost always there's a benefit to working more hours, right? And so getting that information and having them work with a specific benefits counselor that can sit down and look at sort of the numbers for them and calculate, you know, what working more in competitive integrated settings how that will affect those benefits that may be really critical for individuals. I think, you know, expanded training for employment service organizations is also a big one, as well as the business staff and being able to support folks to make those integrated services more efficient. You know, as those priorities shift from, you know, sort of work closures and outcomes and a range of settings to really focusing on CE, we need to make sure that the folks that are delivering those services are trained and feel comfortable and competent to make sure that they can support those outcomes. And then the last one I think for me is just those school and community relationships. And so, you know, if we want to expect the seamless transition, there needs to be a much more strengthened relationship with those adult service providers kind of pushing into schools, and then schools, you know, moving outside of school walls and classroom walls to provide services and to provide support and experiences for individuals in the community before they graduate. And then the last one that we want to touch on is just the policy. So, you know, the first is really, you know, as we talked about, this expanded commitment to competitive integrated employment that we saw in the Workforce Innovation Opportunity Act. That's also a big part of the Employment First movement. And that really is a movement that has taken hold in most of the states in the country right now, in many localities. They're really kind of pushing them to change not only that national legislation that WIOA changed, but also how does state policy and state practices around everything from Medicaid waivers to the way that interagency service collaboration happens to make sure that the focus remains on those CIE outcomes. And so this is really, really important and has shown a lot of potential benefit state by state in some really innovative ways, but certainly a continued commitment and expansion of this is going to continue to provide a lot of promising results, I think, for this group. I think this research also, you know, if nothing else, provides kind of clear message to strengthen and to sustain that commitment to phasing out and ending segregated employment and segregated vocation. And I think if there's no other takeaway from this review of the research, I think that's probably the one takeaway, is that, you know, as Lauren touched on earlier, and as you touched on, you know, I think there's an inclination to think, well, you know, that's not a bad thing, this pre-training, but we're actually not seeing those outcomes, and we're not seeing a benefit from engaging folks in this way. And in some cases, it can actually be detrimental to them achieving those outcomes later. So that has been put out there in legislation, and that's something that this research really emphasizes and re-emphasizes the commitment to. And then the last piece, I think, is, you know, as we've talked about these, this transition alignment and this coordination between different service agencies, you know, that's really informed a lot of times by these larger national legislative policies. And so WIOA really shifted the focus to CIE, but then it also has to connect and coordinate through the transition process with some of these other pieces of legislation. So the Individuals with Disabilities Education Act is what sort of confers special education services in a K-12 setting, and the Higher Education Opportunity Act really provides opportunities for individuals with disabilities in higher education and college settings. But there's still a need as those, as IDA and HEOA come up for reauthorization. So as they're renewed um, and they need to be aligned with some of those priorities of WIOA to make sure that those pieces are also working in conjunction and that they're all trying to achieve that same outcome, and that there's a more efficient sort of alignment of those policies. And so again, sort of just wrapping up, we really appreciate you taking the time to listen to some takeaways from our research. So, you know, just to summarize our findings once again, we found no credible research evidence that supported those segregated vocational options. And what we found was that those integrated vocational services and that direct engagement of individuals with CIE, insight CIE with supports built around them led to better pay, higher quality of life, and more self-determination. So those are the big takeaways that if you don't remember anything else we talked about, those are the two to keep in mind. So we really appreciate you taking the time to listen to us, and we look forward to hearing from you, and we'll be back with more takeaways from our research in future webinars.